I don't know if anybody who is not a therapist will care about this, but I want to talk about the mental status exam. And the mental status exam is a part of documenting services with a person and understanding their mental condition through how they present in the room with a therapist. It talks about their experience of their symptoms. It allows you to, as the provider, acknowledge when something is within that client's normal range or if it is atypical for them, unusual. And it can also share about how a client is participating with the intervention or their own symptoms. The mental status exam includes details about a person's appearance, their behavior, their speech and mood, and their affect. Appearance, things like how old they are, if they look appropriate to their age, what is their grooming like, what's their hygiene, how about their clothing, is it unusual, is it atypical, is it appropriate for the weather, is it neat or unkempt or disorganized. Sometimes when you're working with really severe presentations of people or like children, for example, there needs to be documentations about when someone is doing something inappropriate, like taking off their clothes, for example, or if they're wearing a jacket even if it's summertime, or if they're wearing shorts even if it's 0 degrees outside. Observations about hygiene, like body odor, the way that their hair looks. And this can get sticky quickly, right? Even just talking about it, because we're not doing it to make judgments about a person's appearance. We are making observations about a person's presentation that contributes to their experience of their symptoms, whether that's depression or anxiety or autism spectrum disorder or schizophrenia or bipolar or anything else. It's important to make documentations about how a person acts and what they look like to a trained clinician in order to understand the context of their behavior. Behavior, things like eye contact, movement, posture, engagement during the conversation. Are they avoiding eye contact? Are they restless? Are they really rigid? Are they stiff? Are they fidgeting? Are they picking things up? Are they picking at their nails or their hair? Are they looking away from you? Are they disengaged? Do they have really rigid body posture? Are they slouching? Are they putting their head down? Are they sleeping? Are they unable to stay awake? Speech, how quickly are they speaking? At what volume? Are they using tone? Are they using gestures? Are they moving around? Are you able to track what they're saying? Does it make sense? Is it slow or fast or anxious? Is it quiet? Does it trail off? Mood, and this is different from affect. So mood is their emotional state. And a good way to report this, one way you can report it, is client reported, I am sad. Client reported, I am anxious. I feel depressed. I feel hopeless. I feel numb. You're talking about their emotional state. Are they sad? Are they low? Are they excited? Are they happy? Are they tired? Are they energized? What's going on with their mood? How would they describe it? Versus affect is more about the provider's observation of how the emotion is being expressed. Is someone expressing a lot? Is someone saying that they're sad but smiling and laughing? Is someone saying that they're really happy but they're saying it like with a monotone expression? Monotone, and flat facial expression? Flat, like not expressive, It's my birthday and I'm really excited because we're going and visiting with my family. But you're not like expressing very much emotion within your words. That could be interpreted as a flat affect. Constricted, maybe you aren't able to express what you're feeling. Blunted, like there is no variation. Stunted, unable to express, not there, missing something. It's a blunt expression of emotion. Inappropriate, like I was describing earlier, if somebody describes feeling happy but they're like, doing behavior that's kind of like threatening or whatever, you're like, okay, well, that's like kind of inappropriate because you're saying you're happy but I kind of feel like you're going to come up on me. Or, the opposite is true. If someone is reporting that they feel happy but they are apathetic and not interested in the world around them and not smiling and not engaging with other people and frowning and sunken body posture, that could be interpreted as inappropriate. Elevated, if someone is experiencing a heightened amount of energy or self-esteem or goal-directed behavior, these are like sometimes presentations alongside symptoms or periods of mania for people. But it's a difference from their neutral. Neutral, you can client presented with a neutral affect, or a client presented with an elevated affect, client presented with a low or flat affect. Client presented with an elevated affect, you're noticing increased energy, and that person is changed from how they typically are in relation to like having more energy, more emotional expression, more verbal processing, more social or goal-directed behavior. unusually so. If you are interested in this, I have a free resource on my page about the mental status exam with these different words that I'm describing, and I'm going to go into more about the thought process and thought content next, because that is the other part of the mental status exam. After you've looked at someone's appearance and presentation, you then need to assess the thought content and thought process to be able to guide interventions and treatment in a way that is relevant to how the person is presenting.